We are very happy to have with us today Dr. Wajid Khan, who is also our uh, Vice President and who is an expert on the subject of pain. Pain is a contemporary topic for every one of us, and today we will have his insights and his perspective as a medical specialist on pain conceptually and how we can uh, ameliorate it, or how we can mitigate it to uh, in our own interests and in the interest of, and we can teach others also after we have all these knowledge and insights on pain management. And Dr. Wajid is an expert. He has been in this area for more than 2 decades now, and then now it is our privilege to have him here and to listen to him as expert on the subject. Thank you so much for joining, Professor Wajid. We are so privileged to have you, and I just request you to give us the right kind of information and guidance so that we can help ourselves. Thank you so much, sir. Now, yeah.
Thank you, Poonam. Thank you very much for your introduction. I have already shared the screen, so I'm sure our audience can see it. So, our topic is pain amelioration. Actually, I have given a topic of pain management, and I am obliged by Professor Inam Hussain to choose such a nice word, amelioration. It's more philosophical than explaining a lot of stuff which relates to pain management. I went down to Cambridge Dictionary to see exact meaning of amelioration. It's a French origin word to make a bad or unpleasant situation better. And so I keep the title because it's explaining the actual core of concept, how to manage with pain. Right. So everybody is happy. Shall I continue?
Please, sir.
Okay. So moving onward, now, so about etymology, first attested in English, 1297. I'm talking about how the pain word came to us. So it was from Old French, which is pain, and somewhere in the Latin. Also, we can find his roots, which was mainly punishment, penalty, torment, hardship, or suffering. Greek origin is also available, which is price paid, penalty, punishment. So most of the old literature says that people thought it was related to punishment, penalty, torment, and hardships like that, which was described as a pain. We understand now scientifically it has different meanings and a lot of benefits from it, which was recently find out that how pain help us. But moreover, it's an innate, a primitive feeling, symptom, experience in the body, which actually help us not to defend us, but also to evolve humanity from grassroots to the higher intellectual levels. That's why, interestingly, the pain centers are present near to our intellect in the brain. So, how many people really suffer from chronic pain? There is a variable data. And worldwide, this was in 2016, BMJ published that 40% of worldwide people are suffering from chronic pain. So it's a huge volume and a huge diversity in this problem worldwide. But if we just see what's happening in United Kingdom, so variable types of pain have variable data on their spread. This report was published by Statistica in 2021 August, and I tell you interesting fact that the new data is about to come, that now in 2022 we find that there's a little bit shift in that. Now the major pain after headache is not back pain. It's basically since lockdown, after COVID, and people are working from home with not right ergonomics, people are getting more neck and shoulder pain, which is almost crossing back pain area. By definition, according to International Association of Study of Pain, it's an unpleasant sensory and emotional experience associated with or resembling associated with actual or potential tissue damage. Since 1979, we have been dealing with a definition which was keep going on until 2012. A task force was made with the help of International Association and John Hopkins University in America to make a huge group of leaders in the specialty and neuroscience to revise the definition. So what was the basic reveal was that they change few words from that. They change unpleasant to depressant, more depressing feelings. And before it was only experience, now they say it's associated with, not necessarily that damage should be there. Because in the past definition, mostly it was only associated with actual potential. They say it resembles sometime, but actual injury might or might not be there. So when the definition was revised, it was added on with 6 important keynotes also, which should not be missed considering pain. And number one is that it's a personal experience. It could be influenced by biological, psychological, or social factors with the specific individual or patient, but again, it's a personal experience. And nociception, which we used to say that the changes in the nerve endings and the chemical origin there should not be confused with pain, because they both are different phenomena. Not necessarily nociception or the changes around the nerve ending should produce pain, and the absence of that phenomena does not exclude that pain is not there. There is a neuroscientist, her name is Dr. Irene Tracy in Oxford. She spent around 35 years researching to prove it that we can take out the mockery or functional elements of the pain or the making of pain, which not exact existence and presence, but up till now, we are still not pinpoint scientifically to say that this patient is actually having pain or is describing the pain. With all the functional MRIs and all input, we still can't say that what patient is saying, we have to trust it. We can't say he's wrong. So that's why finally they placed in keynotes that a person's report of an experience of pain should be respected for now. Yes, individuals learn the concept of pain through experience in their lifetime, because everything which developed in the nervous system, when a baby is born, it evolved many things, including the pain system, pain nervous system in the brain and in the peripheral body altogether. Pain does not only support, but it has its own side effects, adverse effects, or bad effects on function, social, and psychological well-being. Verbal description cannot be the only way to express pain. And that was an important factor which was related to specifically people dealing with acute pain in the surgeries and everything. There was a time, I remember our senior colleagues used to say they used to give no painkillers to the newborns if they need any surgery, that they don't feel pain. But thankfully, we realized later on they do feel pain, except they can't express it properly. So there are all other features also available which guide us that this person or this patient is in pain. Even the similar phenomena was used for veterinary science, where animal surgeries and animal pain management was going on, that verbal description is only one way to describe pain. There's many other features which help us understanding. Apart from many ways pain can be explained, There's an important element in relation to pain is to understand it as an alarm system of the body. Alarm systems are very important. Any equipment, any building or any machine, if it doesn't have alarm, it ends up in catastrophe. It has to be a protective mechanism which guide us and tell us, which fear us actually to withdraw from damaging experience, protect when healing is going on in the body, or avoid similar experience in the future. So interestingly, that's why we see a diagram here where the brain is shown, the nerve fibers are taking message of pain, which is a red line. This red line, when it reaches the thalamus, it distributes into many directions to describe, for example, here to tell us this top one red circle to tell us that which part of the body is painful. This the lower circle, red circle, shows us the severity as well as the emotional element of the pain. When it moves forward, this frontal zone tells us to fear from the pain. And then later on, the motor actions and the descending tract, which is green and blue lines, to respond accordingly. This happens when we feel pain. But we see here in the other diagram where the first stimulus was made, when it reaches the spinal column, at the same time, before it reaches the brain even to evaluate, we will withdraw the hand, which is a track called reflex action or reflex act, in which our reflexes from the spinal column, even before we appreciate the pain, work to withdraw and save us from any damaging experience. So it helps healing by protecting body for further damage and also avoid its experience in the future. For example, if a young child who not have experienced pain from a hard object to understand it, when it touches it, it immediately brings this red dot here to make a memory of that. So that next time the child will remember that this object is hot, if I touch, I will feel pain. So understanding pain as an alarm is very vital, not only how it works in the body, but also how we actually understand different types of pain and different mechanisms which are involved in understanding different types of pain and later on their management. So when we talk about mechanisms of pain, we simply broadly describe them in 4 different types: nociceptive, neuropathic, nociplastic, and psychogenic. Nociceptive is a pain in which nervous system related to pain is working perfectly all right. There is no problem in the pain mechanism. And start of pain by the receptors, taken out by the nervous system to the spine, reaching to the brain, and everything is working, functioning perfectly. But actually the area from there where they're taking message, something is going wrong there. For example, if someone got a trauma, someone got an incision or a surgery, so pain pathway is working fantastic, but actual problem is in the body tissue from where it is taking message. That's why it is called nociceptive. Noci means also pain, but its perception of pain is going on. It means there is a tissue in the damage, and alarm system basically is working fine, but there is some smoke or fire is there which need to be looked after. So this is first type of pain. This mostly we see in the acute traumas, people who have acute surgical pain, or patient who start developing a new disease phenomena there. Now, neuropathic. Neuropathic, as the name describes it, neuro means nerves, pathic means disease, when actually there is a problem with the nervous system. So simple words, as we discussed earlier, that we'll take alarm system as an example. So here the problem is going on with the nervous system related to pain. It could be in the periphery, in the small branches of the nerves which are taking message. They could have problem, or could be in the spine, or could be in the brain itself. So that's why it's been divided into central neuropathic pain syndromes or peripheral neuropathy. For example, in diabetes, when their peripheral nervous system start getting trouble, so they start developing pain in the peripheries, for example, in the legs or feet, where the brain and the spine is fine. But those patients who after stroke start feeling pain on one side of the body or the whole body, it's actually the centrally affecting. So in simple means here, itself, the other tissues doesn't have problem. The problem is going into the alarm system itself. Otherwise, I will again take the example, there is no smoke or fire, still the alarm system is making noise. So some problem is there with alarm system. Now, third type mechanism is nociplastic. This again, I refer it to nociceptive and nociplastic. In nociceptive, the mechanism was working fine. There was a tissue damage present from where the receptors were taking message of pain. Otherwise, it was functioning fine. In nociplastic, in this scenario, apparently, physically, the nervous system is fine. There is also no tissue damage or any problem going on in the tissues to take a message, but still the message of pain is coming. This is called nociplasticity, means functional element of the nervous system related to pain is still triggering the pain message to the brain, which is related to the evoke potentials and thresholds. The thresholds have somehow lowered to the level that the other sensation of touch, pressure are being taken and stimulating the nervous system or pathway of the pain. We see such type of patients in which people think it's myofascial or like functional abdominal pain syndrome or fibromyalgia type patients, the famous name for that, widespread body pain. Now, the last, not least, is the psychogenic type of pain. In psychogenic type of pain, here the periphery has less responsibility. The major problem is going in the main center. So the changes in the chemicals of dopamine, serotonin, all those related to depression, anxiety, all those trigger the centers in the brain, and they focus on a portion of the body or the part of the body which becomes somatoform for them. Their focus of the brain continuously trigger the sensitization of that area, and they start feeling pain on that area without any physical or peripheral nerve anomaly or tissue damage or anything. So patients with somatoform diseases or patients with conversion disorders, in which, for example, a person got a depression with something and he described it's not been completely met or not been completely addressed, keep going on there. He's not sharing, he's keeping it in and keep this system or the circuits of electrical energy in that areas keep moving. Ultimately, brain will select a portion of the body to dictate that I have been there. So the problem is going there. So that's how that psychological pressures or stresses were converted into a physical pain in specific portion of the body and that seek attention. So this kind of psychogenic pain is also not only in the air, it's actually physically present there to cause pain. Classification wise, International Association for the study of pain is the biggest organization to dictate, but they really say that it's up to the patient condition and the physician dealing with the patient that according to the body part involved, or if the system or whose function has been affected, like nervous system or cardiovascular system or gastrointestinal system, whatever system is involved, it can be labeled or classified accordingly. Duration and pattern of occurrence is very important. Some patients comes in circles and cycles and episodically. So just like migrainous attacks and all these things. Intensity and cause, if it is diagnosable, they also try to classify in all those terms. So they're given a freedom that you can classify accordingly whatever the findings are there. Now, management approaches, initially it was quite physical. When Bonica is Atlas, and it was the pioneer on making pain management procedures and everything, everybody was seeking for physical approach. Later on, it's been realized that without psychological approach, it cannot be maintained. Finally, we end up in having multidisciplinary approach, which is the best model to deal with pain problems. Now, in physical approach, we definitely have rehabilitation, physiotherapy, exercise, TENS. Trans-Doppler is they put a magnet above the head which send the magnetic waves and try to improve the condition, mostly in psychiatric problems, migrainous type problems, and moreover, acupuncture, light therapy, sound therapy. There's a lot of work has been done recently in Harvard related to piano playing and treatment of pain. Interventional procedures, there's a whole list of procedures, and it's definitely not easy to cover here, but it starts from very simple ultrasound guided injection until we end up in implanting uh, implantable devices like spinal cord stimulator and intrathecal pumps or the spinal pumps, all that. Intra-articular ozone therapy, specifically disc therapy, is in practice. Psychological approaches are basically focused on acceptance and commitment therapy, cognitive behavioral therapy, hypnosis, mindful meditation, mindfulness-based pain management, in which all the management is focused and guided by the mindfulness. Now, minimal invasive interventions, as I discussed, that we basically, if we see all these, we are using few things to alter the functionality, and as we are again related to the title, amelioration of the pain, starting from chemicals to use and alter, reset the nerves by placing local anesthetics or steroid, later on radiofrequency waves, and then heat therapies, which is rhizotomy. Vertebroplasty and kyphoplasty is to place cement in the broken vertebrae that improve their instability and the pressures dynamics which are causing pain. Endoscopic discectomy, when they bulge out, it is also in practice. Implantable devices, as it will. Our first part of the webinar, I will go through broadly as much I can, and then we come to our actual topic, which is pain management as a whole. Now, when we try duration-wise, try to broadly describe pain in different types, we really take four big headings: acute, subacute, chronic, and cancer, depending upon duration. Acute pain, which should last within 30 days of beginning or after healing has calmed down. Subacute is between 30 days to 6 months, and in some literature, 3 months. That duration is very important because this is the transit time when an acute pain can change to chronic pain. When it's only acute pain, it's working as a simple alarm system that the body has a tissue or body has a damage and it's in the evolving healing phase. This subacute phase, which is 30 days to 6 months, is very, very important because all those changes, if it is not addressed properly at that time, can convert into chronic pain, which is itself a disease. In 2011, European Commission finally sit down and say that chronic pain is not only a symptom and experience, is actually a disease itself, because the changes we find at the receptors levels, at the nerves level, spine sensitization and brain sensitization should be labeled as a disease itself. Now, it comes to cancer pain. In cancer pain, there are candidates which are supposed to recover after an ailment and the stresses from therapeutic measures, for example, surgeries, radiation therapy, chemotherapy, all of them generate pain as well. But at the same time, we saw a big population which we have expected outcome 5 years to some people have 6-month outcome and all that stuff. So cancer pain is different, not only because of the duration, but also the ingredients it has there. For example, in metastasis, it's been studied that the metastasis which goes to the bone, they generate more pain than the actual tumor itself. So regarding all these complexities involved in the cancer pain, it should be considered separately altogether. When we were doing training, our DN and the head of the department, Dr. Konohati, used to say, use the formula of 4 C's to manage these different types of pain. So for acute pain, he used to say our goal is cure. We know we're not going to cure the problem, We should reduce the pain level to reach that patient should feel or almost not feel any pain. This is for acute settings. Someone has a surgery and we have to control pain to the level in a balance that patient say, oh yes, I am now pain free. So it's towards the level of cure. Now, when it comes to subacute pain, now this is a careful area where we don't want patient to end up in having a chronic pain. So we not only to look after the pain levels to be addressed properly, but also to look into the patient background psychology and previous problems should be looked so that they should not further dissipate and increase severity to finally end up in chronic state. Now, when a patient has established chronic pain, now our goals are different. We have to keep a balance between the effects of medication and the level of pain management we want to achieve. That's why it is being controlled. That we know that it's controllable chronic problem. It's not a problem where we are looking for cure. When it comes to cancer, yes, our goal is comfort. Our goal is dedicated by the condition of the patient. For example, if someone patient is in serious condition enough to have pain because of cancer which has spread to the whole body, we are looking for comfort levels by using all the techniques, including medications, infusions, implantable pumps, or injections, because whatever time he is left with, we don't know, but actually we don't want him to be in discomfort all that time. So that's why it's a formula of 4 C's for different types of pain. Now, this is very important diagram because 80% of pain management in intervention wise deals around this portion of our body, which is a spine. And when I will say that if we talk about non-interventional or prevention of pain, 100% of our attention is towards this portion of the body, because this is like a highway or motorway of the nerves first entering to spine, and then from there they will reach the center of the brain, which is sitting in the brain. So if this is not looked after well, we can end up in having pain, and any pain can change into chronic pain with all the comorbidities and problems. When we look in this diagram, we see that this is the portion of our lumbar, our back area spine. This area on the left is the front, and this area on the right is the back. We see here there is a vertebra starting from lumbar 1, L2, lumbar L3, L4, L5, and S1. So this is the area which carries a 2/3 of our body weight all the time. And this is L5, L4 is our waistline. So this is responsible for carrying most of our body weight, which is 2/3, and carrying it almost all the time. When we sooner we sit down, we are putting weight there. What we see here is a vertebral body, and it has discs between every other vertebral body. There are joints on the back called facet joints. This is lower portion, this is upper portion, and there's a joint in between. And these yellow color are the nerves coming out. So this whole combination of this portion is very vital in terms we see these jelly-like discs. They are buffers to balance the weight. We are moving, we are twisting, we are turning, we are bending forward, backward, sideways. What is balancing weight is a disc-like, is a structure, jelly-like structure in between the vertebral bodies. And this is the beginning of 80% pain in our body, because this balances the weight, but at the same time, if the weight is not equal on the discs, what will happen? This is, we always see it as a jelly because it moves forward and backward to balance. It has certain level of freedom in between there. So if I will be forward bending too much with my posture, position of handling and doing things, what will happen? A sustained pressure from this L4 and L5 will press, and the disc will press backward. It will bulge there, it can cause tear there, or it can itself dislodge out to press where? These nerves. At the same time, when this happens, this unequal distribution of the weight pull these joints, and people start getting pain from there. So a lot of problems which originate just by understanding this area of the body. And similarly, it is also an example of whole spine starting below the head till the tailbone. The basic formulation with different shape and sizes, the structure is same. We have a vertebral body, we have a disc in between, we have a joint, and we have nerves. And the muscles are covering around them to hold them there. So this area is very important to understand. In the other picture, it's showing the facet joint, which is there in this picture. And from back view, it looks like this one. Now, I have spent some time here just so that we get an idea of what we are going to discuss further. Now, what happens when people say, I have a sciatica? My pain is traveling in the leg and it's reaching the feet. So again, back to the same diagram which we just saw here. So there is a vertebral body, there's a disc here. Somehow the pressure dynamics between this vertebra and this vertebra was bad enough to press from the front and the disc protrude out. And this red portion is showing that the disc has already herniated and bulged. It starts with bulging, it starts with degeneration in the beginning, then a little bulge come out, and finally it can herniate out. And if you go to previous diagram, it is herniating out. Look what it will be doing there with these nerves when it will bulge out completely. Or when it will herniate, it will directly press the nerve simply. And in some cases, it press to the whole spinal column, which is shown here. The disc is bulging out. This is the beginning. And look what is happening to the whole spinal column. This is the motorway of our all nervous system in the body, entering first here before going to brain. So our sensations of touch, temperature, pressure, and pain all are traveling there. If it is pressing there, definitely it's not only physically pressing there, but it's also releasing a lot of chemicals which are irritating the nerves, irritating the joints, and the muscles to go spasm. So this is a classical example. If someone get L4-5 or L5-S1 disc bulge, the pain travel like a shooting, darting pain going into the leg. So I will just go to two examples because they are most important while understanding the core concept which we are going to discuss later on. So the second is facet arthritis. As I shown you, the good form of the joint here. This is the normal joint, how it looked like. And now if we look there, this is the joint which has a wear and tear. That it has completely degenerative in condition. And now what it is doing, it is generating pain, which is not like sciatica starting from back till the feet, but it is the patchy framework. Wherever it has reference of the nerves on our body, it is displaying pain there. Someone have made good picture with the color scheme. If this area is involved, these joints are involved. Similarly, in the neck, there are patchy distributions. So someone who does not have pain going below the knee joint and has a patchy framework, it means the joints are mostly responsible. And definitely there are many other features in history which dictate us that how it affects not only by the joint pain spread through the nerves, but also when the joint keep growing with arthritic change, it's again very near to our spinal column here and very near to the nerves coming out. Later on, nerves get involved as well. And these two diseases are very important to understand the actual dynamics. So when it comes to pain management, I have divided it into two phases. One is the prevention and the other is if the pain persists and continue to go, what we should remember practically, which is more helpful to understand how we can make ourselves better and the whole community. So first of all, when it comes to pain prevention, we better remember three P's. One is the posture, the second is the physical activity, and third is the psychology. So now we start with the posture first. I'm sure that we have that diagram or the picture of spine which we started discussing. So first comes the posture. There are a couple of examples how we make our posture bad. We see here the good posture is shown on the right side. This gentleman is been shown to be standing in a right posture. And we see there's a line which is crossing the ears, and then through our shoulders, and then through our hip bone, and finally end up in our ankle joint. So these are landmarks which we can palpate. Ear is just outside, shoulder is palpable and we can feel it, hip bone we can feel, and the ankle is outside. So if we stand and all of them are in one line, it means our spine is in happy posture. Means the previous picture of vertebrae which we have seen as a first, they are all having right distribution of weight all around. So there is no unequal distribution of weight, there is no tearing happening, there is no bulging and tearing of the disc are happening, and there is no pressure on the joints. So first, and if we see this one is forward headed. If what I have seen mostly in our Asian community, we are struggling with this posture most, forward head. Most of Asian population and the developed areas, somehow we have been through a lot of labor keeping our head low. So our posture in mostly cases is the bended head forward posture. So somehow here we start with getting trouble with the neck and shoulder most of the time. And this was the beginning of problem with the people started working from home when they had bended forward posture and they were looking at laptops in their lap. So here the main problem will come in the neck and shoulder. This posture of a man who is trying to improve the neck posture but making worse of the spine. And this is the third posture, and this is the fourth posture. This is developed country problem. Most of the people, especially male population in Western world, is struggling with this posture because they are too much way back. And that's why the back pain is more common in West as compared to Eastern countries. Now, sitting wise, there are a couple of ways we sit, but see, this is the best posture. The best posture for sitting says that we should not be touching our back. Even if you can see in camera my own back, I don't know if it or not, but it's been tilted so that I should not rely on that. Whenever I will be sitting, I better be away from it. So this is the right posture of sitting in which we keep our spine in right neutral position. The rest, even if we move more forward or backward or lying on like sofas, they are all horrible for the spine malformation and problems. Posture at work, there's a little bit more scientific explanation that our arms and elbows, they should be in one line if we're working on PC. Our desktop or the screen should be aligned with our vision, and that's what we have to be aware so that our leg lines should be neutral in position. And because people who work on computers, the IT related people or researchers and scientists like Professor Inam, they sit for many hours, they should be in right posture, otherwise they will face trouble. And that was the beginning. That's why I told in the beginning that now the statistics are showing more and more studies that actually neck and shoulder pain is increasing because of this malfunction or this malpositioning or ergonomics in place. Now, there are a couple of more examples how we should stand, how we should walk, and how we should lift it. This is very important. When we lift, if we bend like this is the most horrible posture. Most of the spine accidents and back pain start from this posture. We should be using our thigh muscles to bend down to lift something. Similarly, for lying, some people use a very high pillow and some people use a very low pillow, but actually it should be neutral with our head. Our head and our neck should be in neutral position while we lie. Similarly, on the sideways, further examples to show how should be the posture. Now, second P for our pain prevention is basically physical activity optimization. Physical activity optimization, there is a nice pyramid has been explained what should be our day-to-day life. Unfortunately, if we see the most of the people life, the top one, which is should be less than 2 hours, had been gone down to take most of the hours of the day, which is horrible for our overall health. So according to physical therapy, they explain that everyday work which we do daily should include some physical activity, including gardening, walking, cleaning, or stairs. And 5 to 6 times a week, we should be doing stretches and gentle physical activity till the moderate level. 2 3 times a week, we better be doing some strenuous exercise time. And again, 2 hours or less than 2 hours, we should be looking at television or computer, including both. So this is the pyramid for physical activity in someone's weak life. Now, the third P when it comes to pain prevention is psychological well-being. And psychological well-being is very important as well, because that is the actual problem which turn most of the pain problems into chronic pain disease. When it comes to our psychological well-being, we are living in certain circles. We have our own character of mind. We have spiritual avenues there. We have social connections and physical disciplines. All of them together make a personality of an individual. So if it should be looked after very well, that we are not missing any link. Any circle from these four circles, if taken out, the actual individual will not reach their esteem of greatness, which they should be as a normal living being. Now, if the pain persists, we have to focus on other three P's. In addition to the previous three P which we consider for prevention. So we should be still looking after posture, we should be doing physical activity optimization, and we should be involved in psychological well-being. But when the pain problem persists and become chronic, then our answers lies with these three P's. Physiotherapist should be the approach first, and then we have to observe that psychologically or psychiatric any problem is running there. If not, then our final solution is pain consultant, which treat pain with, as we discuss, various physical interventions as well as a multimodal approach. Now, finally, in multimodal approach, all of them work together. Just like a clinic where I work, we have three chartered psychologists. One is related to counseling, one is related to clinical psychology, and the third one is hypnosis. And we have a big team of physiotherapists which have their own specialized areas like neck, back, or sports injuries and all that. All of them have to work together. Otherwise, the needles which we place on the back and provide radiation, to be honest, it does not bring any success until those areas are not met. Now, the core concept. Before everybody starts sleeping, I'm almost getting there. So the core concept is circulation. What we have discussed up till now, the role of all that prevention and treatment of pain basically belongs how the body heals itself. And what healing needs? Healing needs those building blocks which are present in the blood to reach there. And to reach them there, it needs a good and fair circulation. So common symptoms of poor circulation should not be unaddressed. For example, tingling, numbing, cold, extra cold than comparative to normal population, muscle cramps or swelling. All of those are signs that our circulations are not going in right direction. We have to improve it. When circulation improve, healing improve. If the circulation is right, body less likely go into framework of internally spontaneously damage or problems. Even if a damage or problem has arrived in the form of a disease, again the improvement belongs to good circulation. We as a medical doctor, we believe that we are not healers, but it does not mean that we have stopped doing research what heals the body. So ultimately, up till now, the current status and understanding of healing in medical science is that that healing is present in body itself. Body heals itself. No one can heal. Even a broken, fractured bone, orthopedic surgeon has no power to heal the fractured, broken bone, but it can only help healing by stabilizing a fractured bone, by immobilizing them, by aligning them and applying supports with screws and plates and rods. But ultimately, bone has to heal itself. Similarly, if someone has deficiency of any chemical in the body, like diabetes, we use to supplement insulin or the vitamins or inflammatory processes, we can support it. But ultimately, body has to deal with it itself until otherwise the things does not go right way. Similarly, for chronic pain or the pain condition, we can help reduce the barriers which are coming between true circulation in the body. Broadly speaking, we divide barriers into two formats from where we started today's discussion, that physical barriers and psychological barriers. So, physical barriers improvised the day we start improving our posture, because bad posture gives physical pressure and physical pressure reduce circulation. So once we improvise our posture, we start giving improvement in circulation. And then our second P was physical activity. Physical activity improve our circulation again. It's been recommended at least once in 24 hours we should have activity to feel sweaty. It could be stationary bike, it could be a good brisk walk, or anything which give us sweaty feeling once a day, not sweaty with hot sun, by physical activity. And the third P, psychology, which relates to the psychological barriers. So psychological barriers, how they affect circulation. They also affect circulation. I always discuss with patients that if we have a pipe of water in our hand and we are doing gardening, giving it to our plants in the garden, so sooner we press the pipe, the flow of water increase. It increases the pressure of water, not actual the total amount of water going. Similarly, our nervous system from the brain is connected to our blood vessels. The moment I am stressed with something, my blood vessels squeeze, so my circulation reduce. So that's why all those parameters which reduce the stress in the brain, starting from prayers, religious prayers, mindfulness, muraqabah, and yoga, all these things which relaxes mind actually improve circulation. It means it improves healing mechanism in the body. The researchers has found those ingredients which heal the body. They are present in our platelets and plasma. They are growth factors, nerve growth factors, and there are a lot of other cytokines, related hormones and chemicals which improvise. The moment we got cut or something and bleeding start, the first thing we give pressure and the platelets come there to make plugging with the coagulation system to block it, and then they release chemicals to restore the healing process, building material there. So all of that dependent upon right circulation. So this basically has made the foundation of development of new field in medicine, which is regenerative medicine, that we can regrow or heal the damaged structures in the body, which is also based initially to take patient's own blood, separate platelets, plasma, and inject in those areas. And it has been found significant improvement in overall pain management as well. Now, I think this is what we need to know, all of us, that it's connected with others rather than our own selves. Sooner we heal others, we get healing ourselves. Thank you very much for listening and all your patience. I'm happy for questions. Thank you very much.
Thank you very much, sir, for such an enlightening session. There are so many things that we did not know and that we will understand and we will practice also. And we are really obliged to you for sharing it with all of us. I would open the session for question and answers. Assalamu alaikum, sir. Yes, sir.
We always say when there is no question coming, there is a possibility rather everybody understood everything or no one understood anything.
Oh, sir, they may be pondering on the subject still. Professor Idosa, you would like to ask something?
Please.
Okay, thank you very much. That was a very brilliant presentation, and I think I've really learned a lot this evening. Yes, my question, what happens when the pain on the left side of the neck keep reoccurring despite medications and stuff like that? Will simple exercise be able to rectify that? They just keep occurring left side of the neck. What will you say about that? Thank you.
So, thank you very much, Professor Idosa Omriji. So, basically, Idosa, first of all, it described by the type of pain, character of pain, duration of pain, because it will differentiate us. Now, I have made you today a pain physician. If you saw from the presentation, you are a pain physician today. Then is it acute, subacute, chronic, or thankfully not cancer? But also, is it nociceptive, nerve-related, nociplastic? You know that. You can describe it now. I have made it easy for you to understand. But at the same time, the 6 P's which we discussed, they are a role in healing any pain problem. The first, yes, you still have to maintain the right posture. Probably you are pressing one side on the neck, often with your posture, which continuously, spontaneously keep generating those chemicals which are related to inflammation. And your disc might be pressing at that area, if not visibly enough to come into the MRI, but still the chemicals were released there and causing irritation to your joints, causing inflammatory arthritis there. And these chemicals further irritating your nerves passing there. And you know about muscles. I tell you one thing, muscles, there are very few muscle-related disorders in the world. Generalized muscle pain comes with the bad circulation, with the cold temperature. Cold temperature, what it does? It reduces circulation. And muscles has 2 jobs in the body. One is to move the body over the joint. Second is to protect it. Sooner they face the problem, they go into tight spasm. And when a muscle is in a spasm, it means fibers are contracting and not relaxing. If you just keep this hand like this for a few seconds, tight enough, you will start feeling pain in the hand. What does it show? You have just made small muscles of the hand and your hand is sore. So it means you are using energy of the muscles, but circulation because of tightness is not reaching. So that shows in your neck, left side of the neck, you have disc, you have muscles, you have nerves, and you have vertebral joints. So if the pain is coming from the neck, and it's also associated with spasms, it means your muscles are also involved now. And if we see your head is tilted towards left, it means you're continuously, nature-wise, we develop certain habits. And that's why when we keep one side down all the time, it will keep pressing there. We go back to our model of spine, which we see that we are giving unequal pressure on the disc. It has to move somewhere, right or left, forward and backward, and it will apply the strain continuously, which repeatedly pressure will release chemicals there and start giving us pain. Muscles will sense those chemical changes and they try to protect and go into tight spasm. And then you feel muscle cramps and spasms also coming, which is on top of another extra layer of pain. Only we worried about it when you feel a specific nerve pattern of the pain. When it travels from the neck and reach one of your 5 fingers, it means a nerve is involved. If it is not reaching down there, don't worry, nerve is not involved. Or is another thing is neuropathy, when you feel that burning sensations are like currents darting towards your arm and you're reaching your hand. Which is staying over there, it's mostly disc, joint, or muscles.
Thank you very much. I think that was brilliant.
I have one question, Dr. Poonam Arora, can I ask one question to
Please,
Dr.
sir.
Saab?
Most welcome.
Please go ahead, sir.
Dr. Saab, Dr. Wajid, Assalamu alaikum, and Pumas, namaste, and everybody. Just got eye surgery, that's why I'm not really well, but I want to ask one question to Dr. Wajid. Not all the people normally advise me, because I got a back pain and neck pain as well. They said use ice pack. What's the fun in it to use ice pack? Whereas the other people say, aap na garam kapda rakhe, use the warm cloth on your neck, on your back. And some people advise use the ice pack. So this is contradiction. What's the philosophy of using ice pack? But I tried to use both, but I couldn't get successful and couldn't reduce my pain. So what should I do in that particular situation when I've got back pain? Instead, I just use the hard floor, rest of the things, but I'm not really recovering that one. So what should I do?
Thank you very much, Professor Ahmed Sheikh. It's a pleasure to talk to you. Listen, first of all, the way we are sitting right now, the way you are sitting or slouching wherever you're sitting at the moment, to begin with, again, the first we look at your posture. Where is your neck? How come you feel that this neck should relieve and get easier with the pain when we are giving wrong pressure on it? For example, look at my hand. If this, my punch leg is a head, for example, and this is a neck, if I keep my head forward, what's going to happen? It's pressing there the discs and pulling the joints all the time. It will not ease until I may change my habit to bring it down there in neutral position. So there is no, you have to press your chin to reach the right neutral position. You feel, when you put your hand in your neck, you feel the bumps, and bring your head up until you see in the past, the kings have crowns and the leaders have turbans. One of the purpose was to make them proud, the other was definitely to keep the spine in neutral position. Because a crown head, if you bend forward, that crown will fall off. So you have your own crown, alhamdulillah, spiritual crown, keep it up. And don't slouch when you sit anywhere. Slouching causes spine to change into C rather than S. Spine is from S, not from C. So that's why we need to maintain that S. So make some study and research, a scholar person like yourself, on the posture, which is the right posture. Because we develop habits with the passage of time, and we probably adopt false habit in making posture. I am myself slowly improving my posture for many years. Still, I'm not exactly the right posture. It should be learned and taught exactly in the schools when the spine is growing. But I tell you one thing, it is retrievable. It is retrievable. I have retrieved 80% of my bad posture of spine, and I've seen people getting 100% retrieval of right posture. It's a habit which needs to be reversed, and when you start working on that, initially your new muscles will come into action. You will feel even more pain, but it's settled down. The second part of the question was related to hot and cold application. Hot and cold application does the same thing. When you apply hot, vessels dilate, blood vessels, and circulation increase. When you apply cold, it reduces the swelling generated from inflammation. So actual idea is to apply any one of those or one by one both to reduce the pain. Basically, both works for us. This is one basic understanding, that when we apply cold, there's less leaking from the blood vessels, less swelling and fluid accumulation, and less inflammatory process. But I tell you the right secret. The actual secret is not only the swelling which change, is the waves which are generated from temperatures. Temperature has its own waves. When we apply heat, it gives waves, just like we use microwaves to heat up something. So similarly, heat can be given to produce waves. Those waves, when they interact with our nervous system is basically like wires with chemicals and different gates, and then an electrical, biological current move in the nerve. So if nerve is giving pain and you're applying different waves, so those waves interact with them, which that's why the sound therapies and the light therapies, music therapies, they are in coming action because waves interact with that. And when waves reach there, they alter the perception and reduces the element of pain.
Thank you very much. This makes sense anyway. Thank you so much. Very glad.
Thank you so much. Assalamu alaikum. I just want to know, whenever I wake up from the sleep, for example, I do some gardening or so you see this joint, it becomes very painful. So I don't know what does it mean. Whenever I press here, you see, whenever I press here, you see, so whenever pressing here, so after 2 times, it goes away.
Yes.
So is it something you are talking about?
This is very good question. Anyone which comes to us and ask about small joint pain, first of all, they should be ruled out for inflammatory joint diseases. Just like gouty arthritis, just like rheumatoid arthritis, ankylosing arthritis, seronegative, they have autoimmune system in their body where their own body cells accumulate into the small joints and make them stiff and painful. Again, the secret is circulation.
Circulation.
Is circulation. We keep them warm if the temperature affects them. We keep them moving and doing some, there are some exercises in which a holder like this and we press it. Sometimes there's a ball to press it. We don't have at the moment in clinic, but we give it to patients. So that will keep improving the circulation in the small joint. When we press, we actually improve circulation. There are some Chinese therapies are coming where they heat like this. They beat like
Tapping.
this. So that also increase circulation. The core concept behind it, I don't know how they explain, but in science we understand it's improvement in circulation. And whenever I stroke, I increase circulation. Where I press, I increase circulation. The spasm people get massages and their muscle circulation improve. The accumulation of lactic acid, which turn up, move out, and they start feeling better. The pain improves.
And also, it is something that I think it is recommended when I sit for sometimes looking at papers, students' materials and all these things, writing something. Then at an interval, if I go to do some exercise in the form of praying, bending down, standing, going to prostration, again sitting, again going. So if 2 circles, if I do, then become fresh. That means that does not remain there. So people do it in so many ways, but I was told that even after 5 minutes, if you stand from one chair and sit another chair, that is also an exercise. That means the body should be. Now I noted that the other day, one of my friend is sitting. So I told how many hours? He told almost 2 hours I'm sitting. You are watching the TikTok. So it is so surprising these days when you enter there, you cannot come out. Because very simple, it's a little time, but very interesting. What is next? What is next? What is next? And then 2 hours past, doesn't know. So sitting in this position and watching 2 hours. So then not immediately, slowly, the entire body has started giving problem. So now, whatever I see now here, actually, to keep the body fit, the physical exercise, and then people, whenever they feel pain, they take medicine. But it is giving temporary cure, but is it really helping? Because I'm creating another problem with the medicine. Painkillers, it goes to other parts of the body and damage it. So as much as possible, it is better to practice not to take medicine, but to take some precautionary measures to do something. So I think as a medical doctor, it is very much recommended to advise people. Unfortunately, many medical doctors, they are very much cautious about not to smoke. It is very injurious to health, but that gentleman is smoking all the time. So that means the doctors when they advise, they do it. So that means they have to practice it to advise someone else. So I think that now all the things that which you now discuss that we have seen, it is brainstorming matters. So for laymen like us who are not medical doctors, so now next time I will be expecting this sort of, that means, suppose you see now spinal cord, the most important is spinal cord. So now the way we are now watching television, the way we are sitting for TikTok, the way we are continuously, we are sitting in one place for hours. So then we have not taken the care of our backbone the way we need to sit. We have not said that one. So it is creating problem. So I think with all those aspects, how to sit and how to walk, how to, once upon a time I was working in the hospital in Sweden. So I was working with a girl, the nurse. She made me cry. I couldn't leave from that place because what happened, she was trying to lift the bed. Suddenly the backbone, the spinal cord. And from there she could not stand. I was crying myself. I'm a matured man. I couldn't bear the pain of that girl. She's younger, and she was to carry it. So then when I was there, so that I don't get pain, so then the senior person came. He told, first of all, sit down completely. Sit down, and with the hand you have started lifting something. If you just bend and try to lift, that means you are giving problem to your backbone. The pressure is there. So since that day, when I became so cautious, sit fast. Okay. Now I met a gentleman in my life. He's an old man. So there was a 5-story building. So she's going up. There's no lift. Then I told her how this man will be going. Let me see. So the way I saw the way of crossing the lift, first have gone to the one stair and he joined 2 legs together. He did not do like this. Together and then again. Second stairs together. Third stairs, it took time, but when I went the 5th floor with him in that way, it seems that I have not crossed any stairs. I have not, that means climbed any stairs. So wonderful, the way of the method of, it helped me so much in my life. So the other day here in Canada, when I was doing like that, so gentleman, a young man, he went very quickly. He was saying, are you sick? Do you need help? I said, no, I'm very okay. I am not sick. I don't need help. This is the way of how I climb the stairs. If you see 99% people, young people, they do like that. And then when they go after the 15, 16 stairs, they start to breathe. So that means how they did it. But now if you do the way, it will take time, alhamdulillah, doesn't matter. But you are giving rest to your health and you are climbing and you are also taking rest. It's wonderful. So there are certain ways from your experience of life and other experience of life. These things, if we bring together, it becomes a very big chapter. So I shall be also helping you, then you also try to get, that means we're going to advise, as I told you. Now when I cannot even move my hand, then if I go and take 2 Tylenol tablet, or in different countries it is different name, painkiller. If I take 2-3 painkiller, I might get a bit relief, but when there is no harm. If I do a start like this, see this one, I'm pressing here. When I press about 2-3 times, the whole joint is gone.
Joint pain is gone.
Pain is gone. So that means these are the way, how to. So whenever I'm walking, how to walk. When I'm sitting, the way you advise when I'm sitting, how to sit. I'm doing the type work, how to do the type work. So thank you so much that this is a very wonderful talk, and I'll be looking forward for another talk that in our daily way of life, daily life, when sitting, when eating, when walking, so that we shall be doing something and to encourage us, everybody, to move the body in any way it is possible. So this it is very big. Health is the big wealth. If health is gone, everything is gone. There's no peace. If you have got pain, if there is a pain in teeth, so it takes the head, it takes the eyes, the whole things that. So God bless us. I am not that telling that we don't get sickness, but with us we can save ourselves from serious sickness, following some rules and regulations in our daily way of life. Thank you.
I will take opportunity while hearing nice advice from Professor Alam also, that first of all, the word painkiller, we in pain medicine all the time. Every patient come and say, I am taking painkiller, this painkiller. There is nothing at this moment which is actually painkiller. And second thing, we want to optimize the pain, don't want to kill it. It's like someone say, I will kill my alarm system. We don't want to kill the alarm system. It has to be there. There is a gene which is sodium channel 1.7. Those children get birth with gene mutation in sodium channel and they are insensitive to pain. Them mostly die before the age of 3. Because anything happen inside them, they die. Because alarm system is not there. So that's why painkiller terminology is misnomer. It was socially adopted. It's not actually a medical term. Second thing I will say that I have seen activities in various religions. The way they stand, the way they move down, the turn and do different things, moving, even dancing in Hinduism and a lot of stuff. I have not seen physical activities or action in any religion which is not healthy for life. It shows definitely whatever the remnants and we reach there with that it's a golden wisdom which came from God to teach us all. So that's why the parts of all the prayers are actually healthy. Any type of prayer which someone does in their 24 hours, it's purely health for them. It increases their circulation, it mobilizes their joints not to get stiff, and it improves overall healing. But definitely the benefit of belief system, and belief system stays in the brain, it's in the frontal cortex. And if it is not met, it's in the chaos in the brain. And belief system cannot pseudo-develop it. There's a lot of research about that. If someone unfortunately says, I'm not believer, he assumes and they do functional MRI, still that area is silent in the brain. Until unless he truly believes on any belief or faith system, is that area of brain doesn't work at all. And if that area of brain is not working, there's no peace inside the brain. So that's why it has to do a lot with all different types of activities, physical and mental activities, psychological activities related to faith and prayers. They are really helpful, at least in terms of healing and pain mechanisms. Thank you.
Just to bring here one thing, do you hear about that one? Hypnotized operation was done, the hernia operation was done with the hypnotic. That means there is nothing is used. That means no anesthesia or no media. Just the patient is talking and the operation is going on, but he doesn't know that operation is going on. Highlight about that one, please. How this pain can be.
It's actually, brain has two mechanisms which control pain itself. And one is chemical in nature, release of endorphins and all that. And the second system is the descending track, which starts from the core area of the brain, Brufi Magnus, and then it comes down to the spine and looks like a brake pedal while we are driving. The accelerator is the track which take message of the pain to the brain, and the descending track is a brake pedal which stops it, slows it, and even can stop it. One scientist which worked with done thousands of studies how the brain works. 3 years ago, I was in World Institute of Pain conference. 1,000 pain physicians were there from all around the world. And first thing, she is neuroscientist. She was called just to give a lecture on how the pain works in the brain and body. And the first sentence she said to start as an icebreaker of her lecture was that if brain works ideally, we don't live in ideal world, then you all guys will be jobless. It has significant ability to control any pain in the body. Because things are not ideal, that's why the both systems get tired of or don't work appropriately and we feel pain. Similarly, I always give example, patients also, if I'm cutting apple and the knife go through my thumb here, the first sharp pain is very bad. So here starts the pain. When I see this, it's not harmful, it's not dense, mild cut. I might clean it, apply dressing, and then most of the people don't take any painkiller for that. The cut in the skin and the tissue, it will probably take a week before it will heal. But where the pain goes after that? I don't feel pain after that. So what is controlling that pain at that time is the brain centers and the spinal column tracts plus the endorphins release. So brain, if it is someone has capability to optimize with hypnosis to turn on the brain pain controlling mechanisms, they don't need a tablet or injection.
Thank you. Thank you so much. Please.
So, sir, is this permanent or temporary, the effect of hypnosis?
It depends upon the disease process also. And just like you are a computer genius, Poonam, I have a computer problem. I request you please come and correct my computer. You did some software improvement in that which was causing trouble. The bugs were removed, and then you restart my computer. And I ask you, Poonam, how long it will work nice now? When it will go back in trouble? And you will say, Doctor, I don't know. Now it is working fine. How long it will work fine? I don't know. It can come back and turn back to problem again. So at this level, when a patient gets comfort, this is the time to find out actual sources which has bring that patient to this condition. Those has to be addressed. And that is not the objective of hypnosis and deep trance. They actually diagnostically inquire what is the history behind, where was the grim, where was the grief, or where was the assault or something which has triggered that emotion again and again. And apparently it looks like psychological emotions which are playing role. But we see inside the brain is actually a physical electrical activity going on which make all those problems.
Thank you, sir.
Professor Inam has raised hand.
Professor, yes, sir. Yes, sir. Please, sir.
Thank you very much, Professor Aurora, to let me in. First of all, my sincere thanks to Professor Aurora for continuously putting her effort to organize such webinars. This is the third webinars under the webinar series the NSRIC is going to organize. My special thanks to her for nice setup and smooth operation. Second, Professor Khan being the speaker for today's webinar series, it's really a wonderful discussion and presentation. I really loved it. And there are so many things which I had some confusion about how pain management is need to be addressed and from where pain are coming. As a layman, I do not understand that much about this. So I have a small question for you, which is, let's say in every mode of communication, we have a channel to transfer or to translate the signal to the brain, right? It's not, I think, apart from pain management, how I have a small cut, as you mentioned, tip of the finger, and how immediately I am realizing it. So brain can only realize. Actually, according to my understanding, I'm not sure whether I am right or wrong. Any part of the body cannot have this sensation, and only sensation comes from the brain, one of the compartment which is, let's say, responsible for translating signal to the other part of the body. So if this is the case, for example, electricity passes because of the voltage difference. Let's say pressure is translated because of the potential difference, and so on, right? For example, heat is transferred because of the temperature difference. So what makes it way and mood that is responsible for sensation of pain in our body?
Wonderful question. I won't expect you having less than that asking. So it's a whole pathway. The reason I didn't brought it in discussion, because it might, people start, it will take a long time to describe the whole pathway. It's very important ingredient when we start learning pain. So a pain starts with our one palm of the hand. It has 5 million pain receptors. And invariably, where the sensitivity is less, pain receptors are less, but wherever the sensitive areas are more, like face, hand, the pain receptors are more. These pain receptors are of different shapes and sizes according to the nature of pain they take. Pressure-related pain or sharp pain, temperature-related pain, but few of them share also. For example, C fibers are their nerve endings which come on the skin, and they take the message. Skin is most painful. You go further down, the pain is less. Interestingly, the brain has no pain receptor. Brain is free of pain. When people feel pain because of tumors inside the brain, it's actually a stretch receptor in the coverings of the brain called dura mater. These are like coverings of the brain. When they got stretched, they have receptors. Inside the brain, there is no pain receptor. Now, the first thing is that trigger of pain receptor, which is a threshold which has to have reached before the stimulation of this receptor happen. Rather, stimulus could be temperature, it could be pressure, it could be sharpness, a wave, anything which reach to that threshold to trigger a responsiveness in that receptor. Once that receptor activates, it releases substance P there. The name is substance P because it's chemical related pain. That substance P then further go to the nearby pain pathways, nerve endings, which are called spinothalamic tract, because they take message from there and their nuclei are sitting into the spine. So that nerve ending, we call them axons. They take message and they deliver to the nuclei which are sitting into the spine. From there, they relay message to the another neuron, which is second order neuron. First order from the skin of any portion of the body to the spine, and then second order neuron moves from there and activates certain other neurons, and finally end up in having another neuron ending which is sitting into the thalamus. And then third order from thalamus, which is core of the brain relay station, then further give messages which are third order neurons. From there, they display the message of pain to the pain centers, which are mostly dorsal part of insula, which is anterior to the thalamus, central core, and also it brings message to the localization area of the brain. So let us know where is the pain, and then also the severity areas of the brain to tell us how much is the severity of pain, and then to the emotional elements of the pain also. So that we should be, for our safety, as we started discussion, we should fear from those sources which cause or trigger pain. For example, a burning hot metal, when I touch it, I'm supposed to fear. But the defense starts from the very beginning. Even before I appreciate pain in my brain, my hand move out. And then I realize it was painful. So somehow that pathway also, When it reaches the brain, third order neurons, they immediately make a memory. Okay, this is painful stuff. Better not to touch it again, or if you need to touch, be very careful. So between these nerve endings, there are a lot of connections with other neurons. And every connection is dependent upon secretion of some chemicals, which are neurotransmitters. They transmit message from to other. Now your question about where is the potential gradient or potential difference, how the message move. In our nerves, which are like wires, definitely there is a movement of electrical charge, which has been proven, but that charge is not dependent on positive and negative poles. That charge is dependent on positive and negative ion channels, sodium and potassium and calcium. When these ion channels move, they generate an electrical energy movement from one end and corner of the nerve ending to the other end. And they do it by two channels. One is a slow channel, other is saltatory. Electrical message goes like a jumping fashion and when reach and stimulate the other endings. Depending upon the threshold, it keeps further triggering and finally reach there. So and this is the mechanism how we appreciate the speed is in microseconds. It doesn't take us long time before we touch and immediately we take it out. It's even faster, but immediately our brain realizes the burning and the pain and how to manage and control it. So that is we call it as spinothalamic tracts. There are 2-3 variations on that. Plasticity or the chronicity, when the pain becomes disease as a chronic pain, there are changes which develop at the receptor levels. There are changes which are related to the secretion of those neurotransmitters. There are changes in the nerve fibers. There are changes in the spine columns. There are changes at the level of thalamus and also changes in the further deep portions of the brain. So all of them finally called neuroplasticity in the brain. But interestingly, the human abilities has been provided so great by God that all of them now latest knowledge says are reversible.
Thank you so much. I think we are running out of time. It's up to Professor Aurora. Thank you very much.
If it was for me, I would continue it for 1 more hour, but it is not up to me. So I will ask everybody if they want to ask more questions.
I just want to say something. No,
Yes, please.
Want to ask the whole discussion was very impressive and informative. Thank you, Professor Khan. I really liked that whole discussion, and it was really very informative for me.
Thank you, Dr. Faisal. I have a question, sir. Can I ask? Sir, how does happiness correlate with pain? And what about these Buddhist monks and this, they, after meditation, how does the pain channel changes in their brain? And about gamma waves, like what is their role, and things like music therapy, do they really alter the pain pathways?
Very beautiful question. I must say that it's one of my favorite topic in pain management. We go with the evidence to start with. When the brain generates waves, there are 5 main waves, apart from other small waves also. Alpha, beta, gamma, and theta. What have been noticed with evidence in studies that the more pain persists, people are having trouble with having more and more alpha waves. Their beta waves get lesser and lesser, and they got almost depleted with theta waves. The gamma waves are not normally present all the time. They only get provoked if someone is involved in deep meditation. Meditation of any kind will bring those waves. They have healing action. I tell you why. For example, I don't have models there, but I hope I'll manage with hand. This is the relay center. In the center of the brain, brain is like this, which is thalamus. And it is covered by like this, like an umbrella, by the center of emotions called amygdala. So whenever a stimulus arrives there with the pain, it has a medial branch which goes there to stimulate the emotion center. Because we need to fear. Fear is emotion. We need to have emotion-related implications of the pain to deal with it. Now, if you just improvise this umbrella movements, what it will do? It will backfire. So if it is negative emotions like depression, anxiety, stress, it will enhance the pain effect. If it is good emotion, like happiness, like kindness, like helping others, like healing others, or like meditations of yoga, meditation, muraqabah, or Buddhism, all that give back waves, which are calming gamma waves. So they reduce the intensity of pain. And it's been under study a lot. It might be the same that goes with the music also. It brings some gamma. When someone feels the trance, it's a gamma wave, more than the normal feeling. When someone goes into the trance, his brain starts producing gamma waves, which could come from music, from prayers, from meditation. Is someone saying, yes, thank you very much to you from the core of heart. Their body waves, spread those waves to trigger you immediately. Oh my God, something happened to me. That happened to you is a quick run of a gamma wave, which come from the brain also, those centers of emotion. Intellect has a huge role also there, because intellect is just in front of frontal lobe. Behind the frontal lobe, these areas are sitting. So intellectually, when you are in deep trance, your intellect can sleep down, calm down to the level you might feel you are almost asleep. You are awake, but you are asleep. Similarly, if the positive thoughts are emerging, they also trigger those emotions and so they are all very, very physical in the brain physiology. Now, since functional MRI, we actually see those centers moving and brightening and activating once these things do happen. Before Sir Thomas Wallace, 100 years ago, that was the first psychologist, keep telling people that pain, that brain and its structures can be reversed. Brain functionality can be reversed. Everybody just throw awful problems against him, and all the doctors of that time, medical science, say he is nonsense, he don't know science and everything. The bridge came just a decade ago when functional MRI was devised, first time, innovative. Then we get to know, oh my God, that guy was right 100 years ago, he was saying, and everybody was just throwing shit on him that he is mad. And he said, now we know that brain functionality improved, and those changes we develop in the brain can reverse. There was a recent article from Harvard University in which post-stroke patients who are not able to speak, their speaking areas got damaged by playing music and practicing. They started speaking. It means that area redeveloped its functionality just by providing those waves or gamma waves.
Thank you, sir.
You have a lot of gamma waves. I know you have a lot of waves.
I'm highly sensitive person, sir.
The world and humanity need that.
Yeah, I am very stress prone. That is my problem, sir. And we'll discuss it, sir.
And just like crying is a therapy. Just a professor, he is a big healer. Crying is a therapy. Reduce strain and pressures from the brain and relieve all those extra fuels which are generated as a byproduct while brain is functioning 24/7. They get out of these are windows to throw them out, and it gets out when we cry.
Thank you, sir. Thank you so much. Any more questions, please?
Oh, thank you.
No, thank you, sir. Sir, would you like to say something?
I'm so happy that I'm so happy that this is the most important part in our life. There is no man, no human being without pain. It is mental pain, physical pain,
yes,
psychological pain, and pain and pain, pain and pain. So we say that to get relief from the pain, the most important thing in every religion to remember his own creator. irrespective of religion.
Yes.
So how to remember? We close your eyes and say, am I not was a drop of blood in the womb of my mother? Did I have any existence? The hands, the legs, the nose, the eyes, the brain, who have given all these things? We surrender to that Almighty. We ask forgiveness and we ask for the relief of the pains. Then you will get a lot of sukoon, that means peace. Because it depends on if our son, our daughter comes and humbly says, Mom, you are the best, and I want to be your obedient children. So how happy you feel. At that time, your all problems gone. Tears comes in eyes. So how nice and how cute the child Allah gave me, God gave me. So the way we get grateful, and the same way that our Almighty get grateful. This is irrespective of religion.
Yes.
People are doing yoga, people are doing so many things. So let us do ourselves that in our own way. Because this is the same system we are coming up. Then automatically we feel fresh and we feel happy because we are getting attached with a big magnet who has the power, who is moving the entire universe. See, and who can bring the life from death, death from life. So I'm very thankful to Dr. Wajid for bringing up the pain, because this is a big issue now. He has talked about the physical pain today. He did not talk about the mental, psychological, because he's another doctor. People doesn't know that, so we call him Sheikh. He's a professor in Ireland. That is the physical university. He has another power. It's called Sheikh, a spiritual one. So he has that healing also. So we wish and pray he will be coming up with that chapter to us in future. Thank you. That's all from me.
Thank you, sir. Thank you so much, sir. I think there is no time for summary, and we have so many insights that we can just keep on talking about it. And I would request Professor Wajid to help us with another webinar so that we can ask more questions. I'm sure all of us have more questions to ask. So I'm really grateful to Professor Wajid for bringing us such enlightening understanding of the mechanism of the pain. And I would request Professor Hussain also to add on to say something as a concluding remark.
Thank you so much. I don't have personally any thing to add more, which has been covered, and we have lackings of time. So with this, I wanted to thanks again Professor Wajid Khan for bringing this webinar series to the platform, and I also acknowledge and thanks all the people who participated and joined the webinar series. I'm sure that the main mission that NSRIC has, dissemination of knowledge through this activity, we can partially fulfill our commitment, and all these activity document will be archived. Indeed, the last two are already there, so this would be added, and that's how we will be progressing and moving forward in future. Thanks a lot.
Thank you so much, everyone, and we have had a very enlightening session. And with this, I think we can close today's webinar. And I express my gratitude to everyone, all the participants, and our honored speaker, and to Professor Alam and to Professor Hussain for enabling us to be together and to listen to this. Thank you so much, sir.
Thank you.